This video is a quick breakdown of ejection fraction, or EF. Compare patient A and patient B. Based on what you see, whose left ventricle do you think is pumping out more blood with each beat? If you guess patient A, you're correct. The percent in blood the left ventricle pumps out with each beat is called the ejection fraction, or EF. The ventricle fills during diastole and squeezes during systole. After it squeezes, some blood always stays behind and never empties completely in one beat. EF answers this question. Of all the blood that fills the left ventricle, how much of it is pumped out after one squeeze? Most healthy hearts have an EF of around 55 to 70%. In many modern echo labs, the most common way to measure EF is the biplane Simpson's method. The sonographer gets two apical views, four chamber and two chamber, making sure the true apex is included so the LV isn't cut off. Then we freeze the image when the LV is biggest and diastole, and when it's smallest and systole, and trace the inside border of the LV in both views. The machine uses those tracings to estimate the end diastolic volume and the end systolic volume, and it then calculates the EF. Sometimes, experienced techs and doctors can estimate the EF just by watching the heart squeeze. They look at how much the left ventricle thickens and how much the chamber gets smaller with each beat. It can be pretty accurate, but it takes a lot of practice and experience to do it well. Biplane Simpsons is usually more accurate and consistent than eyeballing EF, but it's still operator dependent. Contrast can be used to help the left ventricle show up more clearly. It makes the borders easier to trace for EF. It can also help rule out thrombus inside of the ventricle. And that's a quick look at what ejection fraction is and why it matters. Thanks for watching.